Hello, welcome back to my channel. This is in continuation to my previous topic on nursing diagnosis. That is the planning phase. Planning constitutes the third step of the nursing process. Planning is a deliberative, systematic phase of the nursing process that involves decision making and problem solving. Planning will require the use of your critical thinking skills in which decision making and problem solving are incorporated. After you have identified the patient's nursing diagnosis, planning appropriate care comes next. And planning involves setting, identifying patient centered goals and expected outcomes, and prescribing individualized nursing interventions. The types of planning are initial planning, ongoing planning, and discharge planning. Initial planning is based on the admission assessment. Ongoing planning is done by all nurses who work with the client, and ongoing planning also occurs at the beginning of a shift as the nurse plans the care. And discharge planning it involves anticipating and planning for client needs after discharge. Steps of planning process are setting priorities, establishing client-centered goals, selecting nursing interventions, and writing individualized interventions on care plan. The classification of priorities can be done as high, intermediate, and low. High priorities are the priorities which require immediate care, or in cases of life-threatening situations wherein which might include the ABC, that is, you have to take care of the patient's airway, breathing, and circulation. So administration of oxygen will be your highest priority or the first priority. Second one could be intermediate, or we could say that it could be health threatening, maybe wherein a client or the patient requires a continuity of care, maybe a particular medication or the diagnostic tests. Then the third one, that is the low, wherein we can talk about the developmental needs. These needs can be attended to during the later phase. Maybe if a patient is unaware about a particular health aspect, the health education can be given during the later stage. So that will have a lower priority. The goals of care and expected outcome. So goal reflects a patient's highest possible level of wellness and independence in function, and the goal could be a short-term goal or a long-term goal. And an expected outcome is a measurable change in a patient's status that is expected to occur in response to nursing care. The macros criteria for the goal states that it has to be measurable and observable. The goal has to be achievable and time limited, client-centered, it has to be realistic, and the outcome has to be written, and the goal has to be short. Let me quote an example here of the goal and outcome to be more clear. Supposing there is Mrs. Y is operated, or an exploratory laparotomy is done for intestinal obstruction. So in this situation, my goal will be Mrs. Y will ambulate in 4 days, and the expected outcome can be stated as Mrs. Y will turn in bed independently in 24 hours. Mrs. Y will get up and sit in chair 3 times daily for next 2 days. She will walk with assistance in the corridor in next 3 days and will walk independently by 4th day, so that I achieve my goal through these outcomes. Then selecting the nursing interventions. So these are the activities or the action that a nurse performs to achieve the client goals. The types of nursing interventions are independent interventions, dependent interventions, and collaborative interventions. Independent interventions are the activities that nurses are licensed to initiate. Example, physical care, ongoing assessment, counseling, emotional support, environmental management. The dependent interventions are activities that are carried out under physician's order. For example, it could be administration of medications and carrying out the diagnostic tests. And the collaborative interventions are the ones that a nurse carries out in collaboration with other health team members, such as with the help of a physiotherapist, a social worker, a dietitian, or the physician, etc. So, how there are different types of care plans that a nurse needs to formulate after planning for the nursing interventions. It could be informal care plan, formal care plan, standardized care plan, and individualized care plan. So, the informal care plan is a strategy that exists in the nurse's mind. Now, here it could be the example of taking care of a patient when we are attending to their high priority needs. We may have informal care plan. After assessment, immediately oxygen needs to be administered. Then formal care plan is a written or a computerized guide that organizes information about the patient's care. It provides continuity of care. The third one is the standardized care plan. It is a formal plan that specifies nursing care for groups of clients with common needs. For example, in a cardiac unit, for all the patients with myocardial infarction, we may have a standardized care plan. And individualized care plan is tailored to meet the unique needs of the specific client that are not addressed by standardized care plan. So it depends upon the organizational policies for the formats of the care plan. It could be in the form of cardex or computerized care plan that one needs to follow. So thank you. In my further videos, I'll be discussing about the next phases, that is the implementation and the evaluation phase. In case you have any doubts or suggestion, please feel free to comment below.